I'm Jarvis Odgers, physical therapist and clinic director here at Rebound Physical Therapy. Rebound is an outpatient physical therapy clinic dedicated to helping people get back to the lifestyles and activities that they know and love. Today, I'd like to talk to you about what physical therapy is, what we treat, and how it may benefit you to have a physical therapy evaluation. So first, let's start off with what do we treat? We treat a broad range of ailments, injuries, disorders. So the list would include, but not be limited to, neurologic conditions such as Parkinson's, people recovering from a stroke, multiple sclerosis, inner ear or vestibular systems that might be causing balance or dizziness issues. We treat pelvic health issues, which would be bowel or bladder dysfunction. We also treat disorders of the jaw called TMJ, which might result in either pain with the jaw or inability to fully open the mouth, just to name a few. And then, of course, we specialize in musculoskeletal care. So that's a big mouthful, but that's basically anything that is dealing with muscles or joints. Okay? So as physical therapists, we are movement specialists, meaning we are highly trained to analyze and assess how the human body moves and functions. In addition to analyzing the body, we are also trained to perform a whole battery of functional tests or special tests. So a functional test might be seeing how well or how far someone can walk. There's also some objective balance tests to determine whether somebody is a fall risk. Special tests are typically hands-on tests that give us a good insight to what a specific muscle or joint is doing. So I always tell people I don't have any special powers, I don't have x-ray vision or MRI vision, but typically if you do a thorough hands-on evaluation, you get a really good picture of what is going on in a specific joint or with a specific muscle. So once the evaluation part of a exam is completed, we move on to the treatment. So it's like, what do we do? How do we treat people? First, when we're done, the most important thing is making sure you have a good understanding of what you're dealing with. What are you up against? And then number two is, how are we going to solve it? What do we need to work on to make positive changes to get you out of the situation that you're in? One of my favorite quotes is, no one cares what you know until they know how much you care. And I think as physical therapists, we absolutely exemplify that. We have the absolute luxury of being able to spend a lot of time with our patients. I don't think there's really any other discipline in the medical community that gets to spend as much one-on-one time with our patients. So we get to know you, we get to know what you're struggling with, but also what you hope to accomplish, what you want to get back to. So all of our care is always individualized. You're never a patient that had a total knee. You're a patient that's going through a total knee, but maybe also is a grandma with young grandkids and wants to be able to get down on the floor to play with them. And to me, that is a huge and important thing of knowing what your goals, what your aspirations, what your daily activities are, so that we can help you get back to the road to recovery. As far as treatments, we do a lot of hands-on therapy here, what we'd call manual therapy. So that involves soft tissue work to get muscles that are stiff moving better. Also involves what we would call joint mobilizations. So that is actual stretching for the joint and the tissue that surrounds it. Again, with the idea of reducing pain and getting you moving better. We also do balance training, as I spoke earlier on the vestibular rehab. But then we also do generalized strength. Some people come in and they have weakness. We work on getting them stronger. And then we also do the sports med component, where we're getting people not only back to walking and moving better, but getting back out on the field or the diamond, which involves a lot of functional testing to make sure that that individual is ready to perform at the highest level in a safe manner. And then additionally, to help you get down that road to recovery, we do what we call modalities. So that could be hot packs or cold packs. We use a vasopneumatic compression device, which helps to reduce swelling or edema in limbs. Ultrasound, we've got a couple of lasers here in clinic. E-stim, which is using electricity to reduce pain or get a muscle to move better, just amongst a whole host of things that we do to help you move and feel better and get you down that road to recovery. So if you're out there and you're struggling, or if you're just not able to live your life to its fullest, don't sit back and deal with a functional limitation or an inability to do something. We're here. We want to help you. We want to get you moving and feeling better. So give us a call today.